Welcome to Health Professional Radio. I'm your host, Neil Howard, and I'm glad that you could join us again. We're going to have a conversation with Dr. Christopher Starr. He's joining us to talk about a recent Harris Poll survey that discovered some significant gaps in our knowledge about eye care that could be leaving our eye health at risk. Welcome to Health Professional Radio, Dr. Christopher Starr, and thank you so much for taking the time this morning.
Thank you.
Well, if you would, give us a little bit of background. Tell us about yourself.
Well, my name is Chris Starr, as you said, and I'm an ophthalmologist. I practice ophthalmology in New York City in Manhattan at the Weill Cornell Medical Center on the Upper East Side. And I've been practicing there for, about 14, 15 years now, and my specialty is general ophthalmology with a focus on cataract surgery, ocular surface disease, corneal transplant surgery, and a few others as well.
Now, this Harris poll that uncovered these gaps in our knowledge about eye care, what was the purpose of the poll? Was that the purpose to find out, how much we knew, or was that just one of the results of the poll that was taken for another reason?
Yeah, it's always, we have an opportunity here. The year is 2020, and so what better year for the eye world and eye care and ophthalmologists in general, and the Academy of Ophthalmology to sort of spread the word and learn more about our patients and to try to evaluate if there are any gaps in the greater knowledge of patients. And so this poll was conducted and looked at, interviewed a lot of people to try to get some sort of fundamental ideas of what people are thinking about eye cares and are there any gaps. And so what we did find was that there were some significant gaps that could be actually expected. People had a few misconceptions about their eyes and eye care. And one of the big ones was, what are the leading causes of blindness in the United States? And really only 1 in 5 people actually knew what those were. For those who don't know, I will tell you, certainly with glaucoma, age-related macular degeneration, and diabetic eye disease. Diabetes, as most people know, is very common in the United States and worldwide, actually. And that can very substantially affect vision in the eyes. And that is one of the top 3 causes of blindness in the United States.
Now, with those being the top 3 causes of blindness in the United States, are folks knowledgeable about what causes the diabetes prevention, what causes glaucoma, or some of these other conditions?
Yeah, I don't, really the short answer is no. I think that one of the things that we found in this poll is that we tend to, as patients and as non-medical people, tend to think that they understand these things a lot better than they do. And especially in the world of eye care and sort of eye health, there are misconceptions where people do believe that they know it all. And one of the big misconceptions, and this is a big one, and this is a message that we really do want to get out to people, and that is that symptoms are not always present when there is something that could potentially a problem in your eyes that could lead to blindness or vision loss. It's not always, oh my gosh, I just lost vision, I better go see my eye doctor, or my eye is really red all of a sudden and painful, I need to go. It should not be symptom based, because a lot of these things and actually macular degeneration, diabetes, and glaucoma, the 3 leading causes, don't necessarily always have symptoms early on, and these things can really only be detected on a good routine eye exam. Even if you think your vision is perfect or your eyes are totally healthy, we do recommend regular eye exams for people, because a lot of these things and other things, not just these 3 big ones that we just talked about, but a lot of other conditions can be picked up. Sometimes not even eye conditions, systemic diseases that non-eye related conditions, but diabetes being one of them, can be picked up on routine eye exams, believe it or not, even when you have no symptoms and your vision is 20/20.
These misconceptions, I'm assuming that they start early in life with what we're learning in school and in our communities about, the eyes in general. What are some of the questions that we need to ask, and how honest? I guess we have to be extremely honest with ourselves when we're having a problem and not, blink our eyes a couple of times and then we adjust and think, oh, okay, it's okay. Maybe it's not okay.
Exactly. Yeah. I think, I do think that the eyes and ophthalmology in general, especially even as a medical field, we all, ophthalmologists, we all went to medical school, and we were in class with people who went into primary care and pediatrics and neurology and surgery, et cetera. And ophthalmology is sort of, even amongst those medical professionals, kind of almost like a niche medical subspecialty. Even amongst other subspecialties in medicine, there's very little is known about the eyes because it's such a highly specialized field. And so there's a lot of education that can go around to not only lay people, but certainly other doctors as well. But I think the fundamental issue here is and the take-home message for people, if you're under the age of 40 and you haven't had an eye exam ever, or certainly not if you can't remember when the last one was, then we recommend, and the Academy of Ophthalmology recommends, having a routine eye exam, even if you have no symptoms whatsoever, because we might find that there's stuff there. And of course, your ophthalmologist can educate you. So even if your eyes are healthy, there are a lot of things that can be taught at that face-to-face visit with an ophthalmologist. If you are over the age of, say, 60, the recommendation is, again, even if your vision is fine and you have no complaints, every 1 to 2 years, you should probably be seen, because there are a lot of eye conditions and a lot of the ones that we talked about, but other things like cataract and other conditions are very much age-related. Age is one of the number one risk factors for a lot of diseases, but certainly in the the aging eye can succumb to lots of different things. So as you get older, the eye visits and the recommendations are for more frequent visits. But if you're under the age of 40 and you think your eyes are perfect and you haven't had an eye exam in quite some time, or ever, it's actually fairly common that I see people of that age group who say, oh, this is the first time I've ever seen an eye doctor. You didn't see one as a child, they didn't see one as a young adult, and they didn't see one as a 40-year-old adult. So it's quite astonishing, quite frankly. And this is also one of those misconceptions of, my eyes are fine, I see well, I don't have any, my eyes must be totally healthy. And that's, a major misconception. Everybody should have an eye exam, because a lot of these things are, as I said, asymptomatic, and there could be a problem brewing that could lead to eventual vision loss or even blindness that would not be symptomatic at all. And so it does make sense to see the eye doctor.
And I think in wrapping up, I think it's very important to point out to both us as patients and you as providers that our wonderful brain plays a part in making some diagnoses a little bit tricky as the brain adapts. Talk briefly about how the brain adapts to vision loss, kind of like, if your foot hurts, you walk a little bit less on it.
Yeah, exactly. The brain is very, very powerful, and the brain can what we call neuroadapt. And because we have eyes, two eyes that work together and sum the visual field around us, sometimes there can be a subtle or peripheral problem with your vision in one eye, let's say, that because the brain has this capacity to adapt and to sometimes overlook subtle disturbances in the vision, that we sometimes are not aware that there are significant changes in our peripheral vision or vision in general. And in fact, we do see this. I had a patient, well-to-do patient in Manhattan, working in a high-powered job, came in and was basically blind in one eye from a dense cataract. But because the other eye was seeing well, he didn't really know about it for quite some time until he sort of just randomly covered the good eye, itched it or something, and closed it and realized, oh my gosh, I can't see anything out of the other eye. So with both eyes open, we tend to, the brain tends to block out subtle or even in some cases very dramatic changes in vision. So again, the symptoms are not necessarily always going to be the driving force for an eye problem. People can check their vision. I think it always makes sense if you're going to try to check your vision at home, to check with each eye individually rather than with both eyes open. If you're looking at the TV or something in the distance, cover each eye, try to and And in addition to looking centrally at the clear vision in the center of your vision, peripheral vision is also very important. And peripheral vision, as you know, is not as sharp or clear as our central vision. And so disturbances in the peripheral vision may not necessarily be noticed. But, you can get in the habit of, covering each eye individually and sort of getting a sense for what your peripheral vision is. And if you feel like, gee, one eye doesn't see as far out to the periphery as the other eye, well, obviously that would be something that you'd want to see your eye doctor for. And these are things that we check, by the way, on routine eye exams. We check the vision, we check the central vision, we check the peripheral vision, and we do full checks of virtually everything. Eye pressure, which can lead to glaucoma. That, again, is not usually symptomatic, so that's something we check on regular eye exams. And we dilate the eye and look in the back, and sometimes there can be retinal problems in the back of the eye, little tears in the periphery or detachments even that might not be picked up because, again, the brain tends to block these things out. So this is why routine eye exams are so important and why we do such a thorough job of checking all of these things to be sure that we're not missing anything.
Well, where can we go and get some more information about the AAO and vision loss prevention in general?
Yeah, the Academy of Ophthalmology has a wonderful website at aao.org/iSmart, and it is designed to, it's information curated by ophthalmologists, and it's designed to give people, patients, all people, an education about their eyes and eye smart behaviors and information about eye exams and the common eye disorders. So aao.org/iSmart is a great resource for all patients.
Well, Dr. Starr, thank you so much for joining us on Health Professional Radio. Lots of great information.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this conversation are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.